So we have some moderators for each of our speakers. I'm Sharon Sternfeld. I'm one of the co-chairs of the School Health Committee. And we're going to be asking them of our speakers. I think we'll do one each and take turns unless we want to do the two questions together. Howard's questions. Well, Howard just responded if people were not looking at the chat, kind of like the big question of the day, which is whether or not schools should be opening. So I don't know if he wants to address that.
I'll do it quickly. Yeah. So I do think schools need to open, and I think they can do it safely. It may take a school a long time to arrange having low density classes and having the right ventilation. And I'm not sure how safe it'll be for schools if we have kids who don't have masks in the classrooms. So I'm a little bit nervous about mainstreaming students who cannot wear a mask. But I think if we have everyone masked and if we have decent ventilation and we have all those other mitigations in place, what we're finding, especially from the study that's soon going to come from North Carolina, is that there's less transmission among teachers and students when they are in school than when they are in the community. So school becomes a safer place for both teachers and students if you look at this North Carolina data. So there's no way that we feel we're doing a great job by just keeping people at home, because they're not all at home.
I'll throw in this second question because I think it's a quickie. Several people were looking for recommendation of a CO2 or particle monitor that you could recommend for purchase.
Yeah, no, I think there's, for a particle monitor, there's this thing called the purple counter or something, purple particle monitor. The one I bought wasn't like that. In fact, I bought one that had carbon dioxide and particles all in the same thing, and it was about $169 on. I just found it, by going onto Amazon. So I think they're all pretty good, and of course, as soon as I got it, I did that test where you watch it go up, and then it's working, and you can see what things make it go down. So yeah, I don't know enough about the many brands to really give you a great source. Do you want to go on to the next question?
Yeah.
If I ask Dr. Kumar a question that she received, can you elaborate about the trauma approach that you established in case number 2 and that case number 2 agreed to?
I think case number 2 was the young woman who experiences sexual abuse. And I think that one of the most important things was to just kind of acknowledge, like, hey, I know I'm a little person on a screen right now, but I told her a little bit more about what I did. I made it very clear that she did not need to share anything with me that she didn't want to share. And I thought it was just a consult for depression. I was not expecting it to, end up being something about, to be as complicated as it was. But I think one thing, and this is something we can take from Dr. Pavlovich's talk too, is that you kind of have to have in the back of your head the suspicion for everyone that they may have experienced something bad. And when I hear that people are having trouble sleeping or that they're having nightmares in particular, that's a big sort of red flag for me that maybe this person has experienced, something traumatic. So I think step 1 is let your spidey senses, listen to them if you're getting kind of a red flag feeling about this. And if you don't feel like you have spidey senses, then scream universally the way that Dr. Pavlovich was talking about. So one of the routine questions I ask all my patients, regardless of what they're coming in for, not for a sprained ankle or something, but if they're coming in for an eating disorder or anxiety or depression or what have you, is have you ever experienced or witnessed violence? Have you ever had any unwanted sexual contact? And it makes me sad how many people say yes, even if that wasn't you know, the reason they came to see me. But even if somebody doesn't necessarily feel comfortable answering a question that direct, I think one approach that I often use that is sort of how I employ trauma-informed care is to kind of lob something out in the universe and see if they lob it back to me. So in this girl's case, because I could see that she was a little slow to warm and she said she was having nightmares, I said something like, you know, sometimes people have nightmares when something bad has happened to them. And, you know, I know that can really affect your sleep and so many other aspects of your life, you know, years later. And that kind of creates an opening, because then you're saying, like, you know, I am a provider who understands that bad things happen to people, and I know that you feel, you know, that they often feel shame about it, but I'm not going to shame you. I understand that these things happen to people. And that, in this case, gave her more comfort to open up to me and share what happened. I think, though, and this is key with trauma-informed care, is that you often have to plant a lot of seeds, and they may not all grow, or they may not all grow when you think they will. So you're not necessarily going to find out on your very first visit with somebody what happened to them. It might be 2 or 3 visits later, or it could be a year or 2 later, and they end up, you know, telling you, okay, I'm ready to talk to you about, you know, what's been going on with me. So I think also having that patience about, it can take as long as it takes. I'm here for you. That was a very long answer to your question.
That was a great answer, because I think those are good tactics for school nurses and pediatricians, really. A question. You want to ask this question for Dr. Crowley or Dr. Malovich? Who is assigned to them?
I have a question for Dr. Pavlovich, that there was a couple of people who wanted to know if there have been studies on the effectiveness of teaching specific coping mechanisms such as mindfulness and neurofeedback to help mitigate the effect of ACEs.
Yeah. So the first step here is, again, to remember that ACEs is a risk factor for the disruption of the nurturing relationships and the traumatic event. So one size does not fit all. So yes, there's lots of research for the kids who are outwardly showing symptoms: anxiety, depression, PTSD, sleep problems, outburst, aggressive behaviors. And there's a bunch of different mindfulness curriculums, some actually school-based, in helping with the emotional social learning and also like the physical mindfulness skills. So looking at a lot of the breathing activities, and then showing that even in the youngest kids, yes, they can do it. And then it is improving kind of their self-regulation. So this is all in the context of, can I regulate myself? Can I access my prefrontal cortex to make decisions? And I put a link to the Sesame Street in the community, because when we're thinking about little kids, we're thinking about little kids in terms of being able to do belly breathing. And actually Headspace has a whole kids section, including tips on how parents can teach children to put stuffed animals on their bellies and watch them go up and down. So for all of this, remember, we have a physiologic stress response that is appropriate to the fear being experienced or re-experienced, as Dr. Kumar so eloquently stated. And our job as doctors is to help people regulate their bodies. And so there's lots of non-pharmacologic treatments. Now, some of the other treatments you mentioned in the chat, there's been a lot of work in adults. And there's Trauma Research Institute, Dr. Besser van der Kolk, who wrote The Body Keeps the Score, is a fantastic resource for a lot of this literature. And then the military is doing a lot of studies, because they've been the ones who've been dealing with PTSD. Remember, our kids who have had adverse childhood experience may or may not be showing any behavioral or physical signs. And so our first step is to really see, are they having dysregulation, and have that spidey sense up. And that's why this screening initiative is so important, because it's very different than any other screening we do. We're not telling children or parents anything they do not know about themselves. We're inviting them to share with us and telling them that those experiences are important to understand and deal with in the context of their health, but they're not something that they can't overcome. And so by normalizing screening, and I 100% agree with what Dr. Kumar is saying, that all the acceptability research that has been done, it might not be the first time you screen or the second time you screen. It might be that visit a month later for the cold where they're now, oh, by the way, you asked me about this and I want to bring it up. So the screening initiative through ACEs Aware, part of doing repetitive universal screening is to normalize it and invite that conversation into our medical offices that patients may not think we are ready to hear.
Michelle, did you have one more question for Dr. Pavlovich?
I think just following on the last part about, do you feel that parents are always going to be forthcoming about their responses? And at what point is it appropriate to actually have the patient be the one filling out this questionnaire?
So the questionnaires are available for teens to self-report, 12 and up, and for parents to self-report or to report for the teen. Some practices are choosing, if they're 12 and up, just like with a PHQ or a GAD score, that's not the parent filling it out, it's the patient filling it out. Back to confidentiality. You want to make it a safe space for the child to actually feel comfortable filling that out. But yes, children should fill this out for themselves once we would ask them to fill out any other form for themselves. This is their body, their story, their experience. And then all of the data right now really being collected through UCSF Benny Hoff's Research Institute, looking at focus groups for parent acceptability of all of this, is that yes, parents think it's a good idea. Yes, they're willing to do it. De-identified seems to have a higher endorsement score, getting higher scores if you don't ask which ones, but just the total number, than when you actually have identified scores. But locally, we have practices that are choosing either form because they're thinking about mandated reporting issues. And if they're going to endorse an ACE, I want to know which one. But we can do that through our follow-up questions as well. So far, the research shows that it's actually welcomed and that parents really appreciate being asked and that teenagers will answer the questions.
And Dr. Crowley, we had all compliments and thank yous for you, but my daughter actually, who's been listening with me, came up with a good question. This was such an amazing presentation you did for us. It was so easy to understand. We learned so much. What are these Zoom programs that you're doing with are you doing it with high school kids, adults? How are you reaching out there?
Yeah, so actually I got a private question about that too. So we are doing virtual as much as possible. I've developed a virtual curriculum that those teachers can bring into the classrooms, into their science and health classrooms. And all of that information is available on the website. So if you have teachers who are looking for material, I know a lot of teachers are actually looking for curriculum that's virtual friendly, that information is on there. So feel free to share the website. We also have presentations that we do with the students. Right now, the ones we have are pre-recorded, and so that the teachers can assign the recording, watch the recording, and then the teachers, if they want to, can set up a live Q&A virtual session with us afterwards. So that's been going pretty well. I haven't personally been able to do that yet. I've done a few Zoom calls with smaller groups of students. And like I said, it's a little bit hard because, you know, we're talking about something that they don't want to admit to me that's happening. And so it's a little bit hard to get that anonymity over Zoom that I get in the big group settings, but it's working and we're making it work. So all of that is available on the website, and there's a lot of ways that teachers can request it, or any group. If you guys, if you know of some other group that needs this information, all of that's on there, and I respond to those requests with whatever the appropriate presentation style would be.
We really appreciate all 4 of your presentations tonight, Dr. Terrace, Dr. Kumar, Dr. Crowley, and Wendy Pavlovich, because we're all getting ready for those ACEs. you're making it very much seem doable. We're just hoping to get some more of those resources like social workers and such.